Mental health workers. Why do they do it? 1 in 5 adults lived with a mental health illness in 2020, according to the National Institute of Mental Health. That includes 1/3 of young adults 18 to 25. 1 in 18 adults are affected by a serious mental illness. They do it because they care and we need them. First, you'll meet Jennifer Long, a licensed independent clinical social worker and clinical director of Youth Mobile Crisis Intervention. Then Patrick Sullivan, the adult and youth mobile crisis intervention director. And then last, Jen Sullivan, a licensed certified social worker and crisis clinician.
All right, so I oversee the Kids Psychiatric Emergency Services Program for the Merrimack Valley, and I do this because I believe kids are our future, and there is so many children with such trauma histories and so much need that whatever I can do to kind of mitigate that and improve their lives and make lives better for their parents, to kind of improve our hopes as a species, that's why I do what I do.
Why I do this work, I think certainly it's important, and one of the biggest motivators for me is just being able to make not just a difference in someone's lives, but and also knowing just the important work coming in and out. People are really at a point where they're struggling significantly and in a crisis, that they need extra supports, that they are really reaching out for time of need, and you're making a critical decision that's going to set them up for further treatment in their lives. So for me, it just, again, knowing how important it is for the client as well as family coming here and meeting with a crisis clinician, and certainly very proud of the work that I do.
Because I like to be the rainbow in someone else's life, kind of make them, if I can make them smile or make them laugh, then my job is done.
The second group of people you meet is Esther, a triage clinician and an adult youth and mobile crisis intervention, and then Maria, a nurse at a community crisis stabilization. And then lastly, Roselba, a mobile youth crisis clinician.
Hi, so I picked this job primarily because I really wanted to go to the punitive side of the system. Like, I wanted to work in anything related to law enforcement or to the police department, FBI. When I selected mental health, my background in psychology, I really wanted to understand why people had their behaviors more than how we can punish those behaviors. So I wanted to transition to the treatment line, and this is what I'm doing right now. I think it's far more rewarding than anything that can just give them consequences with no help.
I would say the best day I had working here at CCS would have been when we moved from our old facility to our nice, really pretty facility in Salem, and we were able to decorate. We had a really beautiful space, and I feel like it benefited the patients a lot to be in a new facility. We had nice ocean views, and the rooms were really nice, and that was definitely, moving into that facility back in 2017 in Salem was definitely the best day.
All right, so I chose to work in mental health because I noticed there was a great need, especially for Hispanic therapists. There are not that many of us out there, so being bilingual, I thought there was a need that I could possibly help fill, and that's why I ended up working here, worked in numerous levels of care. But because of there's this need out there, it really just inspired me to kind of see how I can help any way that I can. It started off in higher education and then slowly trickled into mental health. So now that's why I've decided to continue pursuing this, and hopefully one day I can, spearhead a program or something and be able to really just help the community that has always shaped me.
The last group of people you meet is Amanda, a triage mental health counselor, and her sister Anna, a licensed independent clinical social worker.
Okay, so I did this job because my sister encouraged me to work in the social work field.
Hi, I'm the sister that suggested she get involved in social work, and I'm in the mental health field because growing up I had a lot of friends and family that suffered with mental health and substance use disorders, and they didn't have the proper treatment or people in their life to help them get treatment. And so I got into this field hoping that I would be that person for people and I could help facilitate people to feel a little bit better.
Many people do not know how to access mental health treatment. If you or a family member or someone you know is in crisis, you can call the Mass Suicide Prevention Line at 988 for mental health emergencies to be connected to your local support team.